let's talk for a moment about strategies to modulate our arousal level or level of alertness. Because what we want to do is not only educate kids about their arousal level or level of alertness, we want to educate them about how to manipulate it, how to shift. And so one of the things we can do is liken it to downshifting in a car. And of course, many of us don't drive stick anymore, but we can still downshift in automatics. And so, all right, everyone, come on. I don't know what you're doing out there. I know when I watch webinars, I multitask, get all sorts of things done. I don't know what you're doing out there, but I'm going to ask you to join me for a sec, okay? So pretend you are shifting gears in your car, all right? So I want you to do it with me. Shift gears to high, super fast. Move really fast, okay? Shift, low. Shift, high. You see what I'm doing here? I know, it's really hard to watch myself on camera doing that, so it must be really hard for you guys. But what we want to do is literally practice shifting between different levels of speed in order to help our kids manage and understand their level of alertness a little bit better. You remember that when we used to play freeze dance, it's sort of like that. Can we get ourselves all revved up and then immediately shut it down? And we all know those kids who can't. I have one in my house. She gets herself spun up and it's hard for her to shift back down, although as she ages, that has improved immensely. And so we want to think about how we can teach that shifting in a way that feels more seamless and more immediate. Another activity you can do to help with regulation are things like high fives, handshakes, right? Now, of course, some of these things you may have to adapt for COVID if you're a teacher, if you're teaching in school. But you can also, let's say you are a teacher and your kids are on video, you can also have your kids give themselves big hugs to help give themselves input and manage their level of arousal. You can, on camera, help them shift. If your parents living in the house or caregivers living in the house with someone, you can try all of these strategies. What we want to do is acknowledge those shifts, maybe label them. So your body is like Tigger right now, and I really want to try to get back down to poo. Maybe we label them in levels. You're at a 5, and I really want to get down to a 3. Maybe you have a choice board of strategies or a checklist of strategies that help get from a 5 to a 3, or from Tigger to Eeyore. Maybe you want to shift it all the way down, or from Eeyore to poo, because we also have our kids who run at a lower arousal level and need to be able to rev themselves up. And so those are times when things like gum and other things like that can really, really make a difference. So as we think about all of these strategies that we're talking about, and as we know that one of our best strategies is awareness and to get buy-in and to come up with a list of things that your child, adolescent wants to try and is willing to try, we want to think about the fact that effective interventions are a combination of our knowledge as a caregiver, maybe assistance from a clinician, and the knowledge of our child or adolescent. Please don't discount their knowledge of themselves. They have so much awareness that we just need to unlock in order to access it and really make a difference.